Good morning, everyone. Welcome to the Canadian Nurses Association first virtual town hall. Bonjour et bienvenue à la première assemblée publique virtuelle de l'Association des infirmières et infirmiers du Canada. My name is Barb Shellian, and I am president of the Canadian Nurses Association, and I will serve as the moderator for today's first virtual town hall with the Conservative Party of Canada leadership candidates. Mon nom est Barb Shellian et je suis présidente de l'Association des infirmières et infirmiers du Canada. Je serai votre modératrice aujourd'hui pour cette assemblée publique avec la candidate à la chefferie du Parti conservateur du Canada. In our continued efforts to keep Canadians informed of federal healthcare policies and petitions, CNA has launched a new virtual town hall series. CNA is planning to hold 2 additional virtual town halls in 2017 with the NDP leadership candidates and the Liberal Party of Canada. We will announce dates for those events in the coming months. Thanks to everyone who has joined us via Adobe Connect, and also I would like to thank all of those who are watching us right now on Facebook Live. And I would like to take this opportunity to congratulate everyone online for a wonderful Nurses Week, and this is a very good way to celebrate the nursing contribution to the people of Canada. With just over 2 weeks until a Conservative Party of Canada's leadership convention in Toronto, 2 of the 13 candidates have agreed to join us this morning to share their views on important healthcare issues. All 13 candidates were invited, but unfortunately several were not available to discuss the issues. But we are very grateful to have 2 of the candidates here with us today, one in person and one online on the phone. Healthcare is a very important issue, not just for nurses, but also for Canadians, and I like to call it the Tim Hortons conversation, because if you have coffee in Tim Hortons, there's likely 2 things that Canadians will be talking about. One is the weather, and the other is most likely or could be healthcare. And today's virtual town hall is our way of bringing that Tim Hortons conversation to you. I'm pleased to introduce the 2 Conservative Party of Canada leadership candidates who have joined us this morning. In alphabetical order, the candidates are as follows. Chris Alexander. Chris is with us in person today in Ottawa. Chris Alexander is the former Member of Parliament for the Ottawa riding of Ajax-Pickering. He served as the riding's MP from May 2011 to November 2015. His last role in the previous government was Minister of Citizenship and Immigration from 2013 to 2015. From 2011 to 2013, he served as Parliamentary Secretary to the Minister of National Defense. Deepak Obhrai. Deepak is joining us on the line this morning from Calgary. Deepak Obhrai is the current Member of Parliament for the Alberta riding of Calgary Forest Lawn. He was first elected to Parliament in June 1997 for Calgary East. In the previous government, he served in the following roles from 2006 to 2015. Parliamentary Secretary to the Minister of Foreign Affairs and for International Human Rights, and Parliamentary Secretary to the Minister of Foreign Affairs and to the Minister of International Cooperation. Now to get to the ground rules for which we will proceed today, and the candidates have both been apprised of the ground rules. David Granovsky, Manager of Government Relations at CNA, will serve as the timekeeper, and he will monitor and flag the candidates when they're approaching the end of their speaking time. And he will sound a bell, and he can hardly wait till he can do that when the allotted time is up. We'll begin with 5-minute opening statements from each candidate, and following that, there will be a Q&A session, and I will ask 6 questions for which each candidate will have 1 minute to answer. Following this, all of you who are joining us today via Adobe Connect will have an opportunity to ask questions during the questions from the audience segment. You can submit your questions at any time via the Q&A portal, and please address any questions to each of the candidates. Each candidate will again have a minute to answer your questions, and David will give a warning before the candidate's time is up. Likely, because we're all very interested in the topic of the federal government's role in healthcare, we will likely not have enough time to address all the questions submitted by the audience. Therefore, we'll encourage folks to contact the candidates after the event if your question was not asked, and we will share all of your questions with the candidates. This session is being recorded, and the recording will be made available on YouTube, and we will send you a link so you can watch the broadcast at your leisure. In the coming days, a link to the recording will be on CNA's website. So let's move now to segment number 2 of our virtual town hall, which is the opening statements from the candidates. We have a lot to cover, and I'm very interested in what the candidates have to say this morning. So let's start with Chris Alexander.
Well, thank you so much, Barb. Merci tout le monde d'être là, mesdames et messieurs, à travers le Canada et ici avec nous à Ottawa. It really is a huge pleasure to be here with you, and I would like to begin in this Canadian Nursing Week by congratulating you, the CNA and all of your partners and all of your members, for doing this and for what you do every day to make your profession strong and to make Canada stronger. I'm here because it is my firm conviction that this is the kind of discussion we need to be having to move Canada forward. And yes, in the field of healthcare, it's at or near the top of everyone's priority list across the country, in Tim Hortons and around dinner tables at home and in every community you visit. But we should be doing this in every field. This is what leadership is. This is the role of the federal government, not always to fund everything. Healthcare is a provincial responsibility, but to provide leadership, to bring people together, to develop and share best practices, and to be true to the potential that we know we have as a country. And one other point, just by way of beginning, we're in a challenging position. We always are as a country, but we're under pressure in fiscal terms. We don't know what's going to come at us with the global economy or even with our own economy. There are vulnerabilities. There's disruption happening in healthcare and in every sector. And to move forward and be the success that we know Canada can be, we need to think big thoughts. We need to be bold. We need to rethink how we deliver for Canadians. And that's why I put a few slides together for this presentation, which I'd love to show you, that emphasize how I share your vision of better health, inclusive health, healthcare that serves all Canadians and concentrates its efforts on those most in need, wherever they are, in remote communities, in neglected, underprivileged urban settings. But we also need better care. That means a team effort that involves the kind of leadership that mobilizes resources from all levels of government and from across the public-private divide. There are volunteers. There are private organizations. There are voluntary organizations that can play a bigger role than they're playing today. And when we bring ourselves together, we know that that care and the trust it engenders becomes so much stronger. And then finally, we know that we need to be efficient and get better value for taxpayers' dollars. That's what government has had to do in every generation, every year, to try and find these efficiencies. Sometimes we do it better, sometimes less well. This is a time when there's a real premium on that. And in this slide, I've mentioned some of your partner organizations. It's not all of them. put their logos out there to show what a team effort this is and how central you are to the success of the healthcare sector, obviously, but to the success of Canada. On the next slide, I'm just highlighting some of the priorities I've tried to talk about in this campaign that I think line up with issues for you. And we'll get back to some of them in more detail later in this discussion. I think there's room for the federal government in its areas of responsibility to concentrate its effort on better delivery, digital records, better care, better leadership by registered nurses and family physicians to be that gateway for Canadians, in the federal government's case, above all, Indigenous Canadians, members of the Canadian Armed Forces, veterans, to receive the care that they deserve. The Dutch government and other Dutch governments are looking at this model where the client, the patient, the citizen has a first point of contact with the healthcare system. I think we should pilot that beyond what we've already done at the federal level, see if we can get better value, and then share the experience with provinces and territories if it works well. Mental health, same story. We have a very deep and growing experience and expertise in the Canadian Armed Forces with our First Nations of dealing with mental health crisis and dealing with mental health challenges on a large scale. I think we need a task force that takes that expertise to an even broader audience and then potentially across Canada. We'll come back to Pharmacare and delivery, the question of getting value for taxpayers' dollars. The next slide is simply about excellence in nursing for Canada. I think that should be the goal. It's the reality. You are revered around the world for the excellence that is achieved in profession across Canada. I think we can go further, and some of the issues that need to be tackled are here. In closing, and my last slide emphasizes this, bold thinking requires vision. Bold thinking requires leadership. I'm trying to put my plans for this leadership campaign, for our party, and eventually for a new government in terms of a new Canada. I think we need to think in ambitious terms about our role in the world, about the nation-building tasks that haven't been completed, and about a new economy that's going to build on our strengths but going to look very different from what has come before. The same goes for the healthcare sector. Let's be bold. Let's listen to each other, and I'm here to listen to you. Let's put nurses at the center of this because in many ways your success will be the success of healthcare in Canada. And I'm excited to be here for the rest of this discussion. Thank you very much. Merci beaucoup.
Thank you, Chris, for your opening statements. And now, Deepak Obhrai, please go ahead.
Hello there, Barb, and hello, everyone. I am a little disadvantaged. I can't see anything, so I have no idea whom I'm talking to or anything. So if you'll excuse me that I can't see anything, nevertheless, I will just give you my vision of the importance of nursing in Canada. First of all, let me say hello to Chris and to all the others, and move on. So I'm the senior most conservative member of Parliament, having been at age 66 and having diabetes and the others. I, of course, have come in direct contact throughout my life with the nursing care provided by nurses in the hospitals elsewhere. And I must say that we have at par excellence in the world when it comes to providing nursing services. So to them, and being a nursing week, I give all of you nurses and everybody kudos. And from the bottom of my heart, thank you very, very much for taking care of me. That today I'm here because you folks have taken a good care. So again, thank you very, very much. Indeed, nursing is absolutely critically important. A healthy nation cannot achieve its full potential if its citizens are not healthy. And nurses being at the forefront of making people healthy is a critical component of ensuring a great Canada, a great country. I just disagree with my good friend Chris about New Canada. Canada has been built. Canada is running very strong. the nursing profession, the medical profession, the healthcare is already over here, and it has served us very well. And now we just need to look at to see how we can further improve this thing. Certain areas where I feel that the nursing area we can look at is, number one, professional designation. I find it pretty strange that there is a barrier between nurses moving from one province to another province. We should have a system based in Canada that nurses can move from one province to another provinces. We are a vast country. Some areas we need nurses, some areas there may be more nurses, but the ability for nurses to move from one province to another person should be paramount to ensure that we have a good health care and we meet the demands of nursing. We do not, as our population ages, we do need, you will be needing more and more health care, and henceforth the need for nurses will increase. There are lots of innovative ideas out there about home care, how nurses can play a better role in delivering first-hand nurse services. One of the critical areas we are facing with this aging population is funding. And the funding, as you know, is always a component with the provinces who are delivering the services, asking for more money and the amount of money that the federal government has. Henceforth, it should be the nurses out there in the forefront with others to see what is the best way we can deliver cost-effective services without, at any given stage, compromising the excellent job they are doing. So I will look at that as a number one issue. There are other issues coming in here that we are now facing, mental health issues. All of these become part and parcel of a larger policy making into how we address the medical needs of Canadians. And so I would say, and I would be, well, as we discussed today, which is the reason why I am on this, have come to take part in this town hall, is because of personally having been witnessed, personally having been served by nurses. And so I thought I would be there and to say to all the nurses a very, very big thank you. I'm sorry, I can't see, so I don't know what slide or what everything is out there. But this is my opening statement. And as we go further, we can discuss more policies and more issues that come through on how to move forward and to ensure that the services that Canadians are getting, already been done by nurses and everything, are actually are maintained, as well as if there's room for improvement, we move forward. Thank you.
Great. Thank you very much, Deepak, for your opening comments. And we'll now move into the segment called Question and Answer with the President. And as a reminder, each candidate will have a minute or so to answer each question, and David will give a bit of a warning for candidates to wind up. These are questions that are formulated that relate to issues that are important to nurses and important to Canadians. Our first question is about home care. In October of last year, the Canadian Nurses Association, the Canadian Home Care Association, and the College of Family Physicians of Canada worked together collaboratively to launch an initiative called Better Home Care, a National Action Plan, which included a consultation process that went across the country. This plan reflects the needs of patients and reinforces the philosophy that home, not a hospital or long-term care facility, is the best place to recover from illness or injury, manage long-term care conditions, and live out one's final days. One of the key recommendations in the joint report calls for the federal government, through Health Canada, to support the large-scale spread of best practices by leveraging and enhancing current pan-Canadian resources that are building capacity and improving performance in the healthcare sector. And as we know, home care in Canada, unfortunately, is a very patchwork presentation, and your access to home care does very often depend on your postal code. My question to the candidates this morning is, would your government work with stakeholder groups such as CNA to scale up best practices to ensure that home care is improved regardless of where you live in our country? And if so, what would your government do to make it happen? Deepak, I'm going to give you the first chance to answer that question.
Thank you. I absolutely agree. Home care is a priority we should have. As our population ages, more and more people should be staying at their home. When I go door knocking, I find older people out there. Some are worried. I think the best thing, home care, is a very good, excellent, innovative way to move forward. And I would be fully supportive in consultations with your associations, all the others that will provide home care services. And we must work hard to see whatever resources we can do, as you have asked, would be provided to make sure that this plays a critical, important role of taking care of the elders. Most importantly is that hospitals and everywhere else cost a lot of money. Home care would not be that expensive, but would provide first-class services, as well as the premises that you stay at home, and premises you stay at home, the faster recovery is absolutely right.
Thank you very much, Deepak. Chris, your turn.
Well, thanks very much again, Barb. I think the plan is fantastic. I have read it, maybe not every word of it, but most of it, and subscribe to its thrust and its proposals. And in addition to agreeing that leveraging and enhancing current pan-Canadian resources, all the resources that we have, every level of government and every stakeholder in healthcare, I would do the following. First, continue this focus, continue to be demanding in federal government transfers to the provinces and territories that this emphasis on home care be scaled up. Secondly, incentivize everyone through the tax system to be an even more effective player in home care, whether it's family members who are caregivers, caregivers who are not nurses, or all the professionals who are involved from the nursing side and beyond. And then finally, show leadership. And one of the ways we can do that, I think, is by focusing federal resources on the issue of delivery. And I've proposed a health service delivery and management excellence center within the Canadian Institutes for Health, based here in Ottawa. It need not necessarily be in Ottawa, to make sure that we are leading and coming out with the right models for delivery in a home care context.
Thank you very much, Chris. Now on to my second question, which is another hot topic in the Canadian landscape, which is mental health and Indigenous communities. The federal government recently announced $5 billion over 10 years for mental health initiatives, and CNA has been very active on this file. In 2012, we issued a position statement on mental health services, and one of the statements in that position statement was access to mental health services in primary and community-based settings must be improved, and CNA is committed to supporting the development of policies, legislation, and funding mechanisms that facilitate timely and equitable access to mental health services across a functioning and integrated continuum of care. As we know, many Indigenous organizations and communities have identified significant funding needs to help stabilize and expand access to mental health programs. Let's fast forward to when you were elected as Prime Minister. What types of policies would your government introduce to support Indigenous communities that have been experiencing ongoing states of emergencies related to mental health? Chris, it's your turn to answer first.
Thanks. Well, this would be part of a policy focus for a new Conservative government on First Nations issues, Métis issues, Inuit issues across the board. We need to bring those issues, which are already achieving more profile in Canada, to the center of our national discussion, not just reconciliation in the wake of the Residential School Commission work, not just work on missing and murdered Indigenous women and girls. Those need to be focuses, but we need to engage with First Nations, complete the negotiation of treaties, restore teaching, funding for Aboriginal languages and culture, and then address this issue as alongside all of those priorities of mental health. The federal government has enormous expertise in mental health crisis, mental health treatment. We need to turn that expertise into a task force for addressing our clients who are first and foremost Indigenous Canadians, scale up our work to prevent these crises on reserves and in Indigenous communities across the board, and stay focused on this issue until we start to see results. It's absolutely critical to the future success of First Nations communities and to our success as a country.
Thank you very much, Chris. Deepak, your opportunity to answer this question.
Thank you. Mental health in recent years has come to the forefront as we recognize that it is a healthcare necessity and an emergency. You are seeing it happening with people coming from wars, what is happening in First Nations, what is happening with people who are working here who go through trauma and all kind of situations. Therefore, it has become quite clear that this is one area that had not been seen before, that requires excellent attention towards this area. And I'm very grateful and very happy that a lot of organizations are focusing on mental health care. In reference to First Nations, I have come with a proposal, which is that the Indian Act is an old act that gives the Department of Aboriginal Affairs all the powers to run affairs for Indigenous people, including health care. I am proposing that these services be decentralized and be given back to the departments and back to the people so that the departments can provide these services, their expertise they have to the First Nation Indigenous people. They don't have to wait for the Department of Indigenous Affairs to give them money or anything. It should be like what is we treated with other Canadians who get healthcare services provided by the departments. This is what the Indigenous people should also be focusing on, should be able to access that way. Thank you.
Great, thank you very much. On to question number 3, related to the social determinants of health. The social determinants of health are the conditions under which people are born, grow, live, work, and age. And CNA also has a position statement on this issue, which calls for a health in all policies approach to promote health equity for Canadians. We continue to encourage federal parties and parliamentarians to take action on health through such approach that reflects the principles of primary health care. The specific type of care nurses provide enables them to understand the various factors that can affect a person's health, including employment, education, literacy, housing, the physical environment, and more. With the goal of promoting economic growth, productivity, and prosperity, how would your government, under your leadership, consider the consequence of all federal public policies, laws, and programs, whether they're developed for environment, justice, infrastructure, transport, employment, any other department, to improve the health and well-being of Canadians? Deepak, it is your turn to answer the question first.
Thank you very much. You touched a very important subject. If you will recall in my opening statement, I said a healthy nation is a prosperous nation. A healthy nation is needed to provide the services. Healthy nation is needed to ensure that we meet all the challenges of the future. Therefore, we need to look at which is the way, innovative ideas to ensure that we have a healthy nation. Tons of information is available. Primary care is the forefront of ensuring how we can make healthy nations. Education in schools, everywhere else, good living practices, absolutely. Prevention, we all know, is the best way of having a good, effective means of addressing this issue instead of at the later stages when already damage has been done. I therefore say, yes, very clearly, I agree with you absolutely. All resources must be taken at schools, at workplaces, wherever we can to promote healthy living, and of which the nurses profession should be at the forefront.
Thank you, Deepak. Chris, your turn to answer the question.
Well, I very much believe in your approach, health in all policies. I believe in a social justice approach to health. I think we need to be adamant that all Canadians will benefit from the same services and have the same opportunity to be healthy and to receive the right treatment when they are not. But I think the federal government has two roles here. First, to promote healthy living across the board, as you say, in every area, from nutrition to active living and physical fitness. Even financial literacy can have an impact on your health very directly. Digital health, an area we haven't talked about much, but there's emerging research indicating that our digital lifestyles affect our mental health. And then there are areas where the federal government needs to concentrate effort because there are bigger challenges with Canadians living year to year on a recurring basis in poverty, homelessness and the addiction issues, mental health issues that often accompany homelessness, addiction itself. These are areas where healthy living is going to take a much more focused effort to break a cycle and help a group of Canadians take a step forward and be part of that inclusive vision we have for this country.
Thank you very much, Chris. On to question number 4, legalization and regulation of cannabis. On April 13th, Bill C-45, an act respecting cannabis and to amend the Controlled Drugs and Substances Act, the Criminal Code and other acts, was tabled to, and I quote, provide legal access to cannabis and to control and regulate its production, distribution, and sale. As I noted in a media statement, CNA supports a careful and balanced approach towards the legalization of cannabis. We believe sufficient time is required to allow a system shift to take place that will focus on the impact of legalized cannabis on the public and vulnerable populations. Presuming that the bill will pass, would your government recriminalize cannabis use or have an approach that would decriminalize and regulate the drug? And please explain your position. And Chris, it's your turn to answer this question first.
Thanks very much. An important issue, very topical for Canada because of the current government's policy, one that they brought forward during the election and have had to act on in the first 2 years of their mandate. I am definitely not one of those who would want to go backwards to the old status quo. I think it wasn't holding water even over our time in government. At the same time, I'm not prepared to say that full legalization of cannabis use for all adults is the right way to go from a public health perspective or any other perspective. And why? Because first, there is international experience in Europe and elsewhere showing that there are negative consequences from the promotion of use of cannabis to great availability of cannabis. And secondly, we do not have the deep, long-term, clinically based research to say that this substance is not harmful to us, to our health. We spent decades in this country discouraging the use of tobacco. We had great success and great public health benefits from that discouragement and those lower rates of smoking. I would not like to see us encouraging the use of something that is harmful. Let's do the research.
Thank you, Chris. Deepak, your opportunity to answer question number 4.
Thank you very much. I am, of course, very much puzzled as to why legalizing marijuana is a priority in this country for this government, when in reality there are other issues like jobs and the economy. Here in Alberta, we are facing challenges, and yet this is the issue we are discussing. Nevertheless, now that it is already there and this government wants to do it, I absolutely agree with the position your association has taken. There is a need to look into it and for need to see exactly, and the same thing that even Chris is saying, to go look at it further deep and see what impact it will have on the society. As far as if I become the leader and Am I going to go backwards to this thing? No, by that time, this is going to become a law. At that given time, we will start gathering. We will have a lot of information to see what is impacting, and we will see how it proceeds. So therefore, there is a lot of gray areas. It's not easy just to say, yes, I'm going to legalize marijuana. There are a lot of gray areas. There are a lot of areas that need to be addressed, needs to be looked. And the Nursing Association being at the forefront of healthcare would be a very good resource to see, is this really, really helping any Canadian? What is it doing? Is it of any benefit to this country? We have a problem with USA where it is still banned, and we would have traveling problems. I think this is some area that, did not need to be in public service at this stage, but nevertheless that the government has brought it. So let's wait and see. I have a wait and see attitude to see where is this leading to.
Great. Thank you for that. On to question number 5, harm reduction. In 2012, CNA issued a joint position statement with the Canadian Association of Nurses in AIDS Care, and CNA's position is that harm reduction is a pragmatic and public health approach aimed at reducing the adverse health, social, and economic consequences of at-risk activities. An important part of this approach allows for supervised consumption sites, such as Insight in Vancouver. Research into the community impact of Insight and other similar programs around the world shows that safe consumption sites have a positive effect on community safety, reducing the rates of public drug use and discarded supplies without increasing substance use, violence, or property crime. Each of you has received our brief to the Senate on this topic. CNA provided 2 recommendations within this brief. The first was an amendment to include a provision to allow provincial or territorial ministers to grant temporary exemptions to supervised consumption sites. The second recommendation would reduce the criterion for these sites from 5 to 1, where the sole one would consider the local conditions indicating the need for the site. My question is, as Prime Minister, would you advise your Minister of Health to support safe consumption? If not, please tell us why and what approach your government would take on this issue. Deepak, you are the first one up to answer this question.
Yes, thank you. It's a question. Let me be very clear on this. I am not an expert in health or this thing. So your association is an expert, has put forward a proposal over there. Proposals coming from this association. So it is critically important for us, before we make decisions, all this information is available, and you are one of the best resources in this recommendation that you made to the Senate committee of what you're talking about. And therefore, it is at this stage for me and my government to gather all that information and see what is the best benefit we can achieve for Canadians in this area. Therefore, I would recommend for myself, as a leader, that we absolutely cooperate with organizations such as yours to see what is the best practices we can do.
Okay. Thank you, Deepak. Chris, your opportunity to answer the question.
Thanks very much again, Barb. I agree that the policies under consideration, those that you have promoted in your submission to the Senate committee and in other contexts, are a pragmatic public health care approach. I agree that having these sites is a better outcome than doing nothing in the face of addiction and the social breakdown that we see on the Lower East Side in Vancouver and elsewhere across the country. But I'm not satisfied that the model is adequate. I think we need to focus public health resources in Canada on the goal we want to see, which is not just harm reduction, but addiction treatment, reduced levels of addiction. And yes, it requires more research. Yes, it requires more piloting. But I'd like to see any of our efforts towards harm reduction embedded in this larger goal, which will also have to include law enforcement. We'll also have to include all kinds of social programs that go beyond what we see today to try and reduce the vulnerability of populations that are addicted to these substances. We also have to keep in mind that we have obligations under international conventions, both to treat cannabis and other narcotics in a certain way, and we need to uphold our international obligations as well.
Thank you very much. Now on to the last question that you'll receive from me, but I see to my side here the questions are piling up, so obviously the interest is building with our Adobe Connect viewers and participants. But my last question to you as President relates to Pharmacare. In May of last year, CNA appeared before the House of Commons Standing Committee on Health for its study on the development of a national Pharmacare program. The key recommendation in our brief calls for a comprehensive, universal, affordable prescription medication coverage that ensures access based on need and not the ability to pay. Fewer than 50% of Canadians are covered by public drug plans that pay for day-to-day prescription medications, while nearly 100% of citizens are covered in virtually all similar countries. As many as 1 in 5 Canadians reported not taking medications as prescribed because they were concerned about the cost. This increases their risk of poor health outcomes and complications, which is overall more costly to the healthcare system. My question to you would be, what would you do as Prime Minister to ensure that pharmaceuticals are more affordable for Canadians, including vulnerable and disadvantaged populations? Chris, this is your chance to answer the question first.
Thanks very much. Well, first, I've made a commitment to ensure that the 7% of Canadians who have no Pharmacare coverage at all receive them. That would be a first step towards the goal that you set. Universal public Pharmacare would have to be embraced by the provinces and territories in a costed, feasible, workable way, I think, before the federal government could get on board. I would not want to see the federal government imposing this kind of model on provinces who have this responsibility. At the same time, we need to push innovation. We need to push the changes that our industry is driving, is world-class in driving, to make sure we're getting better value, better treatment, faster for Canadians. I'd like to bring our startup community, our biotech community to the fore in helping to drive these solutions, both through the public coverage that is there and through the private coverage that is a reality in Canada at this point.
Thank you, Chris. Deepak, your opportunity to answer the question.
You know, I have, as I've already stated, had some few health challenges. I'm a diabetic. I'm an insulin diabetic. And I have seen that when, you know, today we have a lot of availability to treat your diabetes, but it is very costly. Talking to my other diabetic friends, they say they cannot afford it. But when you use these things, all that is available, it becomes pretty clear that you have a healthy, you can address your concerns on your health care. Therefore, yes, it is very important that Canadians be able to access medical medicines that they need, therefore, you know, for the health benefit. Therefore, I would look at Pharmacare more carefully and more ways to see how it is possible that would a universal blanket Pharmacare be a success, or would it be the provinces doing it with targeted groups and everything? But it is definitely an area that needs revisiting, because we must ensure that the medicines that are coming today, costly or not costly, is available to all Canadians. Again, back to the same old story, a healthy nation is a prosperous nation.
Thank you very much, Deepak. Now you've finished the scripted and very nice conversation with the President, and we are going to open it up now to our Adobe Connect participants. And I can see on the screen we have a wonderful group of people across the country who are interested in having conversations with our candidates. The first question that, and again, the rules are the same. David will give you a signal. We'll give you an hour. Carolyn Pullen, the Director of Policy and Advocacy, has been writing questions down furiously here, so this will be a fun part of our virtual town hall. The first question, and I'll alternate again with the candidates for their opportunity to answer the question. First question is, oh, this is a big one. What are your views on the federal government's role in health care? And Deepak, this is your chance to answer the question first.
Well, we have a healthcare system that is an excellent envy around the world. You can see U.S. is still struggling with the healthcare system. So we do have a healthcare system. We have our 6 principles of healthcare which should be maintained, and we should keep our healthcare system as it is. Now the question that really comes in the forefront is maintaining this healthcare that we have. Is it affordable for us in the future, as many say it is not? But there are ways and solutions in which we can do. Therefore, how do we get best results out of cost-effective results? And the first care person that can provide us with the best knowledge are the nurses to ensure we have that services without compromising the services. I, again, have stated I am a recipient, and I am so grateful. I can tell you right across this country that I have this healthcare system that has been taking a good care of my health. So I am absolutely 100% in support of our healthcare system.
Great. Thank you, Deepak. Chris?
I do think the federal government has a huge role to play on healthcare. The Canada Health Act is the centerpiece piece of legislation driving those responsibilities, but it's also in partnership with provinces and territories and a huge range of stakeholders across the country. I think we play that role through 4 channels. One is reliable, predictable, increasing funding, where we're talking about the priorities that Canadians are setting together with all the partners that receive that. Secondly, we, the federal government, need to focus on our clients, Indigenous Canadians, Canadian Forces members, veterans, and do the very best job for them. Thirdly, we need to focus on innovation. We need to bring Canada's private sector expertise to bear on the public system while keeping it public and universal. And then fourthly, we need to focus on delivery. How do we use these resources better? How do we invest in the front line, which means nurses especially, and service and care to Canadians, and try and make everything that supports that front line as efficient and lean and well managed as possible.
Great. Thank you very much. And Chris, it's your turn to answer this question first. This comes from our Adobe Connect participants. The need for innovation in healthcare is well recognized and discussed at many tables, and we've also talked about that this morning. Nurse practitioners have been highlighted as a resource that is underutilized in Canada today. What would your commitment be to addressing legislative barriers that currently limit NP practice in primary care?
That I wasn't aware that there were legislative barriers before starting to prepare for this session. They definitely need to be addressed. Nurse practitioners should be with family care physicians at the center of this primary care delivery nexus that we want to create. We need to make that profession even more prestigious, well-known, available to Canadians because we know how powerful it can be. We also need to make sure that the mobility issues for nurses and nurse practitioners across Canada are addressed. I would like to see qualifications in every part of the country recognized, from every part of the country recognized in every part of the country, and the barriers to everyone who's qualified playing that primary care role reduced. We need to, as Deepak says, delegate, but then ensure that there is leadership for patients and clients across the country. Nurse practitioners are going to be central to that leadership.
Thank you very much, Chris. Deepak, your opportunity to answer this question.
Well, as I have stated very clearly, nursing profession and first care responders when we talk about it, and I'm not talking about disaster, but I'm putting the word into first care responders for healthcare, our nurses and other practitioners. They can provide us with the knowledge, with the ability for innovation and to ensuring that first-class services are provided. I have already stated that one of my goals is to ensure that there is the mobility of nurses across the country. We should not create artificial barriers to not move forward and to be a barrier towards providing these innovative services. Look, we are getting older, population is getting older, there is the need for money to be out there, there is need for, there will be more expenses. Can we afford it? Yes, we can afford it, provided we provide this innovative ways. This is how, for a long-term healthcare service for our country, for our citizens, is critically important and will be maintained by those in the front. Innovative ideas coming from the first responders.
Thank you. Here's another question from our participants this morning. And Deepak, you'll have the first opportunity to answer this one. You have mentioned, I'm just reading it straight from what's been submitted to us. You have mentioned, and I quote, dismantling the Indian Act. If the Conservative Party's history has included the position not to ratify the UN Declaration on the Rights of Indigenous People, how would you lead your government to a new way of addressing the Indian Act? Deepak.
Thank you. What I am finding a problem with the Indian Act is that it is a draconian colonial type of act that gives power to the bureaucracies how to handle the affairs of the indigenous people. And that's where I say is not appropriate in today's world. Self-governance and decentralization is a better way to go. In reference to the UN indigenous issues that was there, I, as a Parliamentary Secretary for Foreign Affairs, had was there and have been talking about it. And there are areas in which, while that declaration is there, infringes on some of the laws in our country. We got to be ensuring that our laws come first, and then we see how we can compromise on that. But I'm absolutely, in my personal opinion, think the Indian Act has not served the indigenous community very well.
Thank you, Deepak. Chris.
One day, we will move beyond the Indian Act. I think First Nations themselves want to see that happen, but not until there have been final agreements in principle, negotiated with all First Nations. We are, in some respects, 400 years into this process, certainly over 250 years, 60, 70 years since the Royal Proclamation of 1763, in which we committed ourselves to living and partnering, cooperating on the basis of treaties with First Nations. There are still hundreds of First Nations that don't have treaties. We need to complete that process. We need to live up to our existing commitments under treaties and to the promise of self-government. That is non-negotiable as far as I'm concerned, and a Conservative government will be good at this. We negotiated more final agreements in our last 10 years in government than any government since the 1920s. I'd like to see us conclude this process within 5 years, set an ambitious goal, yes, provide more resources. This will generate the certainty that First Nations want and deserve after too many centuries of injustice.
Thank you, Chris. We're going to take 2 more questions. And again, I thank our participants on Adobe Connect who are writing in. And this next question, and Chris, you'll have the opportunity to answer this one right away. What would you do as a leader or Prime Minister to improve access to palliative care in Canada?
Well, I think the home care issue is part of this. We need to create a variety of settings in which palliative care can be delivered in the best way possible for the individual concerned. And that will, for many, be a home setting. In other cases, it will be other settings, private, public, hospital. I think this needs to be a priority for funding. We have an aging population. We have issues about end of life that are coming at us from all sides. We need to show the decency as a society to allow people the dignity to have care in the form that they wish and in the form that they deserve. That's going to be a variety of settings, as I mentioned, from hospices to home, but this should be a priority in our funding agenda and our policy agenda for the future. I think it's a high priority for all Canadians. It's a source of anxiety. It's a source of discord in families sometimes. We need to show that we care and recreate that bond of trust with Canadians that their government and their healthcare services and their nurses will be there for them in a qualified, supported way in the setting that they wish.
Thank you, Chris. Deepak.
Well, as I said before, we have a great healthcare system already here in place. Palliative care is part and parcel of that healthcare system. But are there areas that needs to be improved? Yes, we have areas that need to be improved. And as new technology, as new innovative ideas come through, palliative care takes center stage, because palliative care in the longer term will reduce the cost of providing healthcare services to the Canadians and become more affordable. Therefore, working with your associations and with those who provide the service, medical services, is critically important to ensuring that we have palliative care services that meet the requirements of Canadians, but at the same time, come out with ideas for to ensure it is cost effective. We need to have a healthcare system that is available and not under a burden because it cannot be funded. That would become kind of a priority. But funding, of course, is not unlimited. Funding is paid for by Canadians, by tax dollars. There is an amount that only we can go. Therefore, it is important that we meet both the goals of ensuring an effective healthcare system, but a healthcare system that is there for Canadians meeting their requirements.
Great, thank you very much. Now on to our last question, and this is a good one. What steps would you take to make Canada more innovative in the realm of healthcare? Deepak, it's your opportunity to answer this one.
It's a great question. It's a real open-ended question over here. Excellent. That's what we've been talking about throughout all this thing. What would we do to ensure innovative in healthcare system? Who are the front runners? Who are the first responders? Nurses, doctors, medical professions, I can tell you, and I should say this very clearly, politicians should be way at the back of it, not in the front of trying to provide healthcare services because they don't have the expertise. Those who have the expertise, you sit with them, you ensure that they are part and parcel of making the decision-making process so that we can use all of their expertise, their ideas, their innovations to ensure that we have a system that we can afford, and then it is one of the best that Canadians, can feel comfortable with, that during their ages, during the time when they need the system, it is there. Once more, the first responder that I should say, politicians at the back.
Great, thank you very much, Deepak. Chris?
Well, I think this is the key issue, and it starts with discussions like this. As Deepak says, we need to be listening to you. We need to be listening to nurses and other experts across the country, as well as patients and Canadians, and framing up our agenda for innovation on the basis of that. It needs to involve careers that are innovative. We need to see nurses becoming nurse practitioners, playing primary care roles in a wide variety of ways, in a way that's governed by the market, by the needs of Canadians, and nurses becoming physicians as well. There need to be bridges because there will be new professions and new demands and new niches to be filled in the future. Nurses are going to fill a huge number of them. We also need literally entrepreneurial innovation. I would put in place a health innovation fund at federal level to incentivize the provinces to use more of the great ideas, products, processes, services, drugs coming from the Canadian startup community at an earlier stage. And obviously on delivery, there's lots of room to bring digital platforms, to bring partnerships, to bring the network that we've been talking about throughout this discussion to the center and to leverage the resources that are already out there in a more effective way. I think that's part of being innovative, and And we in Canada have every reason to be at the forefront of this in healthcare and in nursing. Let's continue this discussion. Let's do it again soon.
Thank you very much. We've come to the end of our inaugural town hall, and we've all lived to the end of it. I first of all want to thank the CNA staff for making this possible. And we don't just flip a switch and this all happens. It literally takes a village to produce and organize and get this sort of thing organized. So on behalf of myself, President of CNA, I want to thank the CNA staff for their work related to this. I want to thank the candidates for participating today, for being on the phone, for being present, for recognizing that this is an important issue. But also I want to congratulate you on your courage and your commitment to public service. It's not everyone who can do this, who wants to do this, who wants to put themselves out in the public arena for questions, for criticism, for just being there for Canadians, and that your opportunity and your willingness to talk about the issues of the day is admirable, and I respect both of you for taking the time in your lives to commit this way. We want to wish you all the best on May 27th and beyond, and we hope that everyone here in the room and online on Facebook Live and Adobe Connect have found this helpful and informative. We have a template now, so we're probably going to charge ahead and do a few more things like this. Stay tuned for future events. You see David Granovsky's email address on the slide in front of you, and you also know that you can phone him at 1-800-DAVID or 1-800 number on the screen at extension 525. Wish you all the best for the day. Thank you for joining us, and Happy Nurses Week again to everyone. Thank you.